You're listening to the Mother to Baby podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of three, Chris Stallman.
Welcome to another episode of the Mother to Baby podcast. My name is Chris Stallman, genetic counselor, teratogen information specialist, mother of four, despite what our intro says. And back today to talk once again about some updates on COVID-19. Before we get started, just to remind you, a teratogen information specialist is someone who gives information about exposures during pregnancy and breastfeeding, as well as before pregnancy and in cases of adoption. And an exposure can be anything. It could be an over-the-counter medication. It could be an herbal supplement. It could be a vaccine or a virus, like we're going to talk about today. With us again today, we have two experts who are also Mother to Baby teratogen information specialists who have been kind enough to talk to us about COVID-19 in the past. We have Kirsty Parada from Mother to Baby California and Lori Harris Sagatabai from the North Carolina service. Ladies, how are you today?
Doing well. Thank you, Chris.
Yeah, great to be back.
Great to have you back. Although I wish we could be here under a little bit different circumstances. But the good news is we're going to talk about some updates about COVID-19, including the vaccine. But before we get to updates, I would love to hear how the two of you have been doing. And Kirsty, I've heard that you have some news to share with us.
I do. We are expecting our second baby boy in March of this year, so we are very much looking forward to that.
Yay, congratulations. How's it been in all of this craziness going on?
It's definitely been an interesting experience. You know, working from home with a toddler and being pregnant is definitely exhausting some days, but we are surviving, and there's definitely good news on the horizon with these vaccines coming out that we're going to be talking about.
We are getting tons of communication. So phone, email, chats, I'm sure text is right up there as well. Pregnant women, breastfeeding women, and the vaccine. The number one question is, is it something that I'm able to get? What do we know? What information is out there? So ladies, please share.
Yeah, like you said, Chris, we've gotten tons of questions. I know on the live chat service, which I'm on every day, we get questions about this back to back, and people are understandably wanting to learn more about this new vaccine. The ones that were approved in late last year are both mRNA vaccines, which are a somewhat new technology as far as vaccine development goes. So the unfortunate thing at this point is that we just don't have a lot of great pregnancy data, or we don't have any pregnancy data thus far, or lactation data on how these might affect a developing baby or a breastfed baby. So there's definitely a lot of questions that are still out there and a lot of unknowns. But on the other side of the equation, there are, of course, so many benefits to getting vaccinated against something like COVID-19. So that's what we're hearing a lot about from healthcare providers specifically, which are in the first wave of those getting offered the vaccine, kind of weighing those risks versus benefits and trying to make an educated decision about what they want to do.
Yeah, and the fact that we don't have data or research about the vaccine in pregnancy is just because pregnant people were not included in the first clinical trials that were done. But the lack of data doesn't mean that it's necessarily harmful or that it's not harmful. It just means that we don't have information specific to pregnancy yet. There were some people in the clinical trials who became pregnant during the course of the trials, and so those pregnancies are being followed. So that will be one source of information. So far, there haven't been any reports of adverse effects on those pregnancies. And then there are some clinical trials specific to pregnancy that should be coming up very soon. That will be another source of information for us.
Right. And then CDC also offers some reassuring information, basically saying that based on the way that these mRNA vaccines work, they are unlikely to pose a risk to the pregnant person or the fetus because mRNA vaccines are not live vaccines, which are typically the type that we avoid in pregnancy. So they're not going so far as to say they are 100% safe because, again, we just do not have the data to be able to convey that information. But based on what we know, their statement is offering a good amount of reassurance.
And I think both of you bring up some really excellent points. So, Lori, the idea that because we don't have data doesn't necessarily mean, that there is something that we're worried about or that we will be, but really more that at this point, we just don't know. And Kirsty, speaking of guidelines, so of course the Centers for Disease Control and Prevention does have information, as you say, and some bit of guidance. I know the American College of OBGYNs also have some guidance, and the Society for Maternal Fetal Medicine. Are all of the guidelines consistent in that, are they saying this is something that, if a person is part of these groups that are being offered the vaccination at this time, that this is something that they can consider getting?
That's correct.
Yes, they are consistent, recognizing that at this time, based on the way that the vaccine works, based on what we know about the safety of other vaccines in pregnancy, that it's not expected that getting the vaccine before or during pregnancy would increase pregnancy risk. Certainly, all of those organizations encourage women to have conversations with their healthcare providers about, the risks and the benefits that are particular to their circumstances. Taking into consideration what is the spread of the virus in your community, which basically everywhere there's pretty significant spread right now. Also taking into consideration how much of a risk of exposure do you have from your personal activities or your job. Certainly if you are a frontline healthcare worker or you have direct patient access, then you probably have a higher chance of coming into contact with the virus than maybe other people do. So taking all of those things into consideration, but certainly having a conversation with your healthcare provider is not a requirement before getting the vaccine.
Good to know. And Kirsty, if I could get personal a little bit, just for a second. So, of course, I've had 4 pregnancies myself, but I got to be honest, I'm not pregnant at this time, not planning on pregnancy at any time in the future, and I'm no longer breastfeeding. And so, I cannot truly put myself in the shoes of someone who has to make this decision during pregnancy, for example. And so as someone who is currently pregnant, I was wondering, is this something that, you've considered, or really what questions or what concerns do you have as a person who's pregnant, as well as a teratogen information specialist?
Yeah, that's a really great question, Chris. I am obviously very pro-vaccine. I got my flu vaccine. I got my Tdap vaccine this pregnancy. So definitely all for those that are recommended in every pregnancy. But with this one, it is a little different because there's no data yet. Mm-hmm. So like other moms, I'm really kind of thinking through those risk versus benefits that Lori outlined. Luckily, I'm able to still work from home and have pretty limited contact with the outside world. So in that sense, I feel like I'm somewhat protected against COVID, but there's always the chance you could get it when you have to run out to the grocery store or whatever errands that you have to do. So it's definitely a tough decision. I haven't technically been offered it yet, so I have not had to actually make that decision. But if I do, it's definitely going to be something I'm going to want to think through further, talking to my OB and again, weighing those risks versus benefits. But something that's really important, I think we could touch on, is just kind of the difference between getting vaccinated in pregnancy and getting vaccinated while breastfeeding, because they're very different scenarios.
I agree completely. And I'm so glad you brought this up, because this is something that, as a specialist, we talk about all the time, that pregnancy risk or potential risk is not the same as when you're breastfeeding. And there are some key differences there. And actually, former MotherToBaby president and someone that you work with directly, Kirsty, I know, Dr. Christina Chambers, has an article where she was quoted in Stat News about this very issue, about the pregnancy aspect being different than someone who is breastfeeding.
Yeah, so like Dr. Chambers mentions in that article, there's really a big difference between getting the vaccine while pregnant and getting the vaccine while breastfeeding. During pregnancy, of course, there's a lot of development happening at very critical periods, and most exposures that mom has, including vaccines, have the potential to enter the blood, cross the placenta, and reach the baby. With breastfeeding, it's somewhat different, though. There's a really helpful statement that came out from the Academy of Breastfeeding Medicine, which talks about how it's unlikely that the mRNA vaccine would enter the bloodstream and even reach the breast tissue. And if it does, it's even less likely that the intact mRNA would transfer into milk. So that provides a little bit more reassurance in regards to getting the vaccine while breastfeeding.
Another point in breastfeeding is that if there is any vaccine material that should happen to reach the breast milk, once the baby swallows that, it will be destroyed in their stomach acid. It's not something that's expected to pass into your system from the stomach. If that were the case, we could be taking these vaccines by swallowing them rather than having them be injected.
And it's so amazing to watch, all these pieces be put together. There really is no substitute for well done data. Absolutely. But nothing is going to stop. The world is going to continue to turn, and we need some guidance. And I'm so glad that, people such as Dr. Chambers and others, the many, many others who are thinking about this and working on this, and the trials that are supposed to start with pregnant people, hopefully in the very near future, that they are trying to put these pieces together scientifically, logically, in order for families to make these decisions that we know are very important to them, and in the face of everything unknown, can be really scary.
I think one of the concerns that some people have, Chris, about this vaccine is that there's the impression that the vaccine was rushed, and that perhaps all of the safeguards that may be generally put in place with other vaccine development were not there. But that's actually not true. I think that some of this may come from just, phrases like Operation Warp Speed and the race for a vaccine and those kinds of phrases that were used because there was such urgency to make a vaccine available in the face of this pandemic. But this kind of mRNA vaccine, although it's new in terms of the types of vaccines that have been made available for the public, the research and the science behind this type of vaccine is not new. mRNA vaccines have been studied for the flu, for Zika, for rabies, for other types of viruses. So it's really actually very exciting that now we actually have an mRNA vaccine that is being made available to the public.
And I think too, Lori, to sort of add to your point, it can seem scary because this is something that a lot of people worldwide have been hyper focused on for a long time. I got to tell you that, I have some experience with vaccines and how the regulatory system works in the United States, but I've never had as much information in the general news sources that I look at than I have with the COVID-19. And so it's sort of there in the forefront and we're thinking about it. And I think if you don't know how long it typically takes, or you're not sure how emergency use works, again, it can seem rushed and scary. And I'm, again, just glad that we have these sources to say, yes, this is scary. We acknowledge those feelings, absolutely. But let me tell you how it works. And that can, put some people's mind at ease.
Right. And because of the need for a vaccine quickly, that's why the emergency use authorization came about. But these vaccines were required to meet the same safety standards as any other vaccine, and they did go through the same process of clinical trials for safety and efficacy. Even though we may not have organizations that have come right out and said, absolutely, if you are pregnant, get this vaccine, there have been some reassuring recommendations. For example, there's no recommendation to wait any period of time to become pregnant after getting the vaccine. There's no recommendation for routine pregnancy testing before getting the vaccine. And if you get the first dose of a vaccine and then become pregnant, the recommendation is that you still get your second dose as planned. So even though they haven't come right out and said, yes, get the vaccine, these kinds of statements and recommendations do provide some reassurance that no adverse effects from the vaccine in pregnancy are expected based on what is known so far.
That's a really good point to bring up, Lori. Thanks for that. Okay, so thinking about the vaccine, and let's say that someone decides to get the vaccine, are there any side effects that would be of particular concern, especially in pregnancy?
Yeah, that's important to talk about. There's definitely common side effects from the COVID-19 vaccine, including things like pain and swelling at the injection site. Sometimes you might have chills, tiredness, headache, and even possibly a fever. And these are all good things, right? Because this is your body's way of reacting to the vaccine, generating that immune response, which is going to train your immune system to respond should you actually come into contact with the COVID-19 virus down the line. So it's a good thing. It's expected that this might happen to people that get the vaccine. But specific to pregnancy, one that we want to look at a little bit closer is fever. So we do know that fever, a high fever that is sustained in the first trimester, has been linked to an increased risk for neural tube defects, which are defects of the baby's brain and spinal cord. So if you get the vaccine and you develop a fever, it's really important that you talk to your healthcare provider right away about how to lower that fever. Typically, acetaminophen is the pain reliever and fever reducer of choice in pregnancy. But again, check with your doctor before taking any medication. But again, it's really important just to make sure that you do control that fever and that it does not reach a very high temperature for a long period of time early in pregnancy.
So, Kirsty, what temperature would be considered either borderline or in that high fever area?
So specific to the risk for neural tube defects, we typically would say a fever of 101 degrees or more for a period of at least 24 hours would be a concern. So again, if you notice any fever, it's important to get in touch with your healthcare provider right away to figure out how to lower it.
Absolutely. And that goes for all pregnant women, especially those who may not be vaccinated and or may think that they're sick for a different reason, or hopefully not, but in case they feel that they have COVID-19, it's a super important thing to make sure that you pay attention to your symptoms. You are not bothering your healthcare provider by calling and checking, especially during pregnancy. So if there's something that's making you uncomfortable in any way, make sure you contact them if you can.
One other thing I just want to mention, though, is that it's currently not recommended that you take acetaminophen or any fever reducer prophylactically, meaning before you get the vaccine. So you really want to wait and let your body kind of have that normal response and see if you even end up with a fever before deciding if you need to take a medication in pregnancy.
Good point, because I have seen, not related to pregnancy, but some other people saying, well, before I go, I'm going to make sure, the pain in my arm in case I get a headache, that kind of thing. And yeah, as usual, we'd like to, have the least amount of something for the least amount of time. This is so much good information to have. And again, I know we're getting it in drips and drabs and bits and pieces, but we're so happy to be able to have these updates. And in addition to everything that we talked about today, of course, we have resources on our website, MotherToBaby.org. So Kirsty and Lori actually were responsible for the COVID-19 fact sheet that we have, and also the fact sheet about the vaccines as well. And ladies, am I correct in assuming that they're updated pretty regularly as we get new information?
They definitely are. We are always on top of updating it when any information becomes available. And of course, at this point, we do just have the 2 mRNA vaccines that are approved for use in the United States. But definitely, down the line, we anticipate that some more vaccines might be coming out. And those might be using different technology as well. So it's important that we kind of look at each different one individually to evaluate the risk and, of course, see if there is any pregnancy or lactation data that we can include. So definitely check the fact sheet. It's the most up-to-date place with information. But if you have further questions, you can always give us a call, chat with us, text us. We have multiple ways to get in contact.
Excellent. And we are going to review those in just a couple of minutes. But before that, of course, I would like to thank the two of you again for your time, for your expertise, coming here and chatting with us and giving some information to the listeners. And before I let the two of you go, I would just like to offer the chance for both of you to leave a final thought, something that we really should take away from the conversation we've had today.
I would add that an important part of sort of weighing the risks and benefits that we didn't talk about is what are the risks for a pregnant person if they do get COVID-19. People who are pregnant are not necessarily more likely to get COVID-19 than other people are, but if they do, they may have a higher chance of having serious complications from the illness than people who are not pregnant. And so that includes things like being put in ICU or needing to be put on a ventilator. And certainly having complications like this during pregnancy can increase the chance of pregnancy complications like preterm delivery. And so in thinking about risks and benefits, consider that getting the vaccine in pregnancy may help reduce the chance of these complications caused by COVID-19. by protecting you against infection.
Definitely. That's a great point, Lori. I think my only final thought is just that I'm very excited that we have vaccines here in such a record time, less than a year after the pandemic was declared. We are getting shots into people's arms, and that is just such a testament to the scientists and the researchers that have worked on this. So that to me is really just the silver lining. And even if I don't have the opportunity to get vaccinated during my pregnancy, it does make me feel a lot better that my healthcare team is going to be vaccinated. I know my OBGYN got her vaccine a couple weeks ago. A lot of the nurses at the hospital are very eager to get theirs. So I'm hoping by the time I arrive to have my baby in March that we're going to have a lot of vaccines out there and hopefully see cases decline by that time, which will be definitely a positive.
That would absolutely be a good thing if we were seeing a downtick in cases. And Kirsty, before I let you go, I'm sorry. I know I said one more thing, but sorry, you're on my show. I apologize. Studies. Talk to me about studies.
Oh, yeah. So mother-to-baby pregnancy studies, we are always looking for pregnant and breastfeeding women who might be interested in participating. We do have ongoing studies looking at both COVID-19 infection in pregnancy and lactation, as well as getting the COVID-19 vaccine. So if you are interested in learning more, definitely check out the website. Like Chris said, that's MotherToBaby.org, or give us a call and we'd be happy to talk to you about what's involved and how to get you signed up for that.
I love being able to speak with the two of you about this information, just to keep putting it out there. So keep up the good work, please. And this is a formal invitation to have the two of you come back in the future and keep us up to date with everything that would be going on.
Definitely. I'm sure we will have some sort of update, whether it's on the disease itself or the vaccine in the coming months as we learn more. So it would be great to come back and talk to you about that, Chris.
Yes, that would be excellent. And Kirsty, hopefully there could be some baby pictures, maybe, if you're interested in sharing.
Definitely.
Well, in case we don't have you back before then, we would like to wish you the absolute best of luck and the safest, smoothest delivery you could possibly have.
Thank you so much.
My pleasure. And that is it. Thank you all so much for joining us. I hope that you'll join us again in the future. If you have questions about COVID-19, the vaccine, anything during pregnancy, breastfeeding, if you go to MotherToBaby.org, not only will you find all the information we have available there, both on our web pages and in our fact sheets, you'll also find information about how to join a mother-to-baby study, and you'll also find information on how to chat with a mother-to-baby specialist through that website. But in the meantime, I would like to wish all of you safety and comfort, and remember, Mother2Baby is here for you. Take care.
Mother2Baby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about Mother2Baby, please visit MotherToBaby.org.